Acupuncture describes all aspects of female reproduction as the interrelations of the internal organs and their linked channels. In terms of the organ anatomy, the heart, kidneys, and uterus form the center of reproductive activity. They control the process. The heart is considered as the emperor. It serves as a master controller over the physiological and hormonal cycles in the body. In the Western physiological model, this role is ascribed to the hypothalamus and pituitary glands. The heart stores Shen-spirit, and so it rules the psyche. Shen has a powerful effect on the menstrual cycle. The heart channel unbinds the chest, regulates and rectifies qi, and opens the orifices. That's improving cognition in modern terms. All points of the heart channel have Shen-spirit calming properties. The heart is susceptible to the emotional upset. Anxiety is the pathological emotion that is linked to the heart. Food stagnation from the stomach channel can transform into phlegm and affect the heart. Rebellious qi from the stomach can cause heart fire disturbance. In many instances, instead of working with the heart channel directly, we can choose the pericardium channel, especially in case of the stomach channel involvement, because the Fu Yang Ming stomach and Han Jiu Yin pericardium channels are connected as an extraordinary pair. The heart channel does not have direct access to the reproductive organs, but it bears its influence over the reproductive function through the kidney channel and the gallbladder channel, its extraordinary pair. Kidneys dominate reproduction. Three aspects of kidneys are recognized: Jing-essence, Yin and Yang Qi, energy. Jing is the medium that manifests the unfolding of female physiology. Progression from puberty to pregnancy and menopause are all expressions of kidney essence. The eggs and sperm are classified as kidney essence. Kidney Yin and Yang Qi expand the influence over the hormones which regulate different parts of the menstrual cycle. Kidney Yin and Yang also influence libido and sexual function. The ovaries belong to the kidney system because they store eggs, which are classified as essence. The kidney channel plays an important role in the treatment of infertility. Points in the kidney channel below the navel are used to build back the constitutional level, because these points regulate the Chong-Penetrating vessel. The Chong vessel originates in the uterus and can be applied to treat a wide variety of gynecological conditions. Kidney points on the lower abdomen all have regulating effect on the lower burner. Kidney 14 is the main point to break up qi, blood and fluid stagnation, and kidney 15 is the main point to build up kidney yang. This pathway of the kidney channel also connects with the Ren Conception Vessel at the points Ren 3, Ren 4, and Ren 7. On the foot, kidney channel points connect to the Yin Qiao motility vessel, another important extraordinary vessel to treat reproductive function in women. The pathway of the Yin Qiao motility vessel passes through the lower abdomen. This channel can be applied to treat pain in the genital region, uterine bleeding, and leukorrhea. The kidney channel also connects with the Du governing vessel below the tip of the coccyx at the point Du1 and pericardium channel at Ren 17. The heart and kidney channels form a Shao Yin Axis. The heart channel belongs to the fire phase and the kidney channel belongs to the water phase. The kidneys control the heart's fire, and the heart's fire stimulates movement of the kidney water. If we are to combine the fire and water trigrams, they form a hexagram number 63 named GG, already forwarded. This auspicious hexagram is symbolic of life and vitality. The ovaries belong to the kidney system because they store the eggs, which are classified as Jing-essence. The uterus, fallopian tubes, and cervix belong to the curious organ system. The curious organs are the brain, bones, marrow, uterus, blood vessels, and the gallbladder. The gallbladder is a unique organ because it belongs to both 12 regular and curious organ groups. The gallbladder serves as a bridge between the curious and the primary organs. The gallbladder channel has a pathway that originates from stomach 12 and moves inward to the lower abdomen, where it wraps around the genitals and emerges from the sacrum, the bladder channel. The gallbladder holds the uterus in place. Foot Shao Yang gallbladder channel balances hand Shao Yin heart channel, so the gallbladder channel has a powerful effect on the physiological and hormonal cycles. The gallbladder is the most important primary channel to influence the Yang extraordinary vessels. The points of the gallbladder channel access the Dai belt, Yin Wei Linking, Yang Qiao motility vessels. In particular, the Dai belt vessel has a profound effect on the uterus. This vessel regulates menstruation and treats infertility. One important application of the Dai belt vessel is to discharge vaginal accumulations. A simple treatment protocol involving this channel clears HPV infection and precancerous cells in the cervix within a matter of weeks. The liver is another channel that enters the lower abdomen and encircles the genitals. It connects with the Ren Conception Vessel at Ren 2, Ren 3, and Ren 4 points. Liver 13 point is the origin of the Dai belt vessel, and the Yin Wei Linking Vessel passes through the point liver 14. The liver channel controls cyclical processes in the body, and so it is responsible for the timing of the menstrual period. It regulates qi and stores blood. The Ren Conception and Chong-Penetrating vessels are the only two vessels that emerge from the uterus. The Ren Conception Vessel originates in the uterus and ascends towards the head. This vessel is thought to be the Sea of Yin. Acupuncture points on the trajectory of the Ren Conception Vessel on the lower abdomen. Ren 2 connects with the liver channel. Ren 3 and 4 connect with the spleen, kidney, and liver channels. Ren 7 connects with the kidney channel. Of this group of points, Ren 3 is best at guiding out dampness and stagnation. Ren 4 is the best point for overall boosting of the vitality, and Ren 7 is the best point to treat menstrual disorders. It can be applied to break up accumulations in the lower abdomen and guide out dampness. Another important point in this area of the body is Ren 6. This point regulates qi and blood and boosts qi and yang. The clinical difference between the Ren and Chong vessels is that the Ren Conception Vessel is best at managing yin stagnation and breaking up accumulations, and the Chong-Penetrating Vessel is best at building up the body in case of deficiency. The spleen belongs to the earth phase. It is responsible for the production of qi and blood. It also plays an important part in blood circulation and keeping the blood in the vessels. The spleen is the channel to treat menorrhagia and mid-cycle bleeding. The spleen channel's internal pathway enters the lower abdomen and connects to the Ren Conception Vessel at the points Ren 3, Ren 4, and Ren 10. The spleen channel also connects to the kidney and liver channels at spleen 6 point. It also connects with the Yin Wei Linking Vessel at spleen 12, spleen 13, 15, and 16. Through the Yin Wei Linking Vessel, the spleen channel has influence over the endocrine system and regulates the thyroid and parathyroid function. The points on the Yin Wei Linking Vessel can serve as a parasympathetic stimulant and help to control hysteria. For the practical application of this information, we need to understand that the acupuncture channel system connects all acupuncture meridians into one complex network. Good pulse and tongue diagnostic skills in conjunction with tracking the menstrual cycle serve to identify the sick meridian and determine excesses and insufficiencies in the body. A treatment strategy should be based on this assessment. In choosing the right acupuncture channel to treat the imbalance, the sick meridian should be sandwiched between the healthy meridians so that they can balance it. During the treatment program, ask your patients to chart their basic body temperature. Compare this chart against the dates of acupuncture sessions, the introduction of new herbal formulas, and other relevant information. Make sure you treat your patients at least twice a week for the period of at least 2, preferably 3 menstrual cycles. This will give you enough time to identify the impact of your strategy. I hope you find this information useful. If you like this content, please remember to press the like button and to subscribe to my channel. More videos like this are coming. See you next time.